the clots, so hopefully you'll get that. So we have talked about digestive system in terms of basically the path the food takes. We have talked about the anatomy of each of these organs so far. So I believe we talked about the small intestine last time, and that's where we stopped. We looked at some of the enzymes that are important in terms of, which was the previous slide, which was important in terms of digestion, more specifically chemical digestion, because it's using enzymes, chemical digestions for the effective digestion and absorption of the nutrients in your small intestine. So please make sure you guys are familiar with the names of these enzymes, and then basically, again, remember that these enzymes are not actually produced by a small intestine. They're produced by the pancreas, and a small intestine basically get to use them. And you guys see the connection in terms of the ducts in just a minute. So let's go ahead and take a look at our pancreas. So our pancreas is a very important organ. We talked about this last time in terms of people who passed away as a result of pancreatic cancer. I have kind of mentioned this at the end of the lecture last time. But when we're looking at the pancreas, one of the most important things I want you guys to understand that it has two separate functions in our body. One that is directly related to our digestive system, and that function is identified as exocrine function, as in you're releasing something into a different system. These cells that are responsible for the exocrine functions are called acinar cells. And these cells are basically the one that are going to release the pancreatic enzymes. So again, pancreatic enzymes are basically everything that I mentioned here: the maltase, lactase, sucrase, amylase, peptidase, lipase, and there are many more actually, not just these, but all of these are basically involved in digestion of the food and are produced by the 90% of the pancreas, specifically the cells called the acinar cells. Now, interesting fact about these enzymes, when these enzymes actually get released from the pancreas and find their way to the digestive system, they are actually identified as inactive. Basically, they're not going to cause any changes in the pancreas. They're going to wait until they get to the small intestine. So the inactive version of these enzymes are referred to as zymogens. Now, as soon as, again, they enter the digestive system, what happens to them is they get activated, or more specifically, the duodenum. The other part of the exocrine function, which is also important, is they secrete bicarbonate. Anybody remember the importance of bicarbonate in our system? What was the importance of it? We mentioned it a few times already. Anybody remember? Does that sound familiar? Let me start with that. Does it sound familiar? Okay, wait, guys, don't remember what it was associated with? Okay, well, thank you for honesty, at least. So they're actually associated with the buffering system in your body, which basically means they're going to help you return the acidic environment back to a more basic environment, which is what we want. Remember, the chyme that is entering the small intestine or the duodenum is actually extremely acidic because it's coming from the stomach. So the small intestine is not equipped to handle that acidity. So what is our solution? One of the solutions is to release bicarbonate to basically neutralize that acidic environment. Yeah. Good, awesome. Yes, so it is highly alkaline, correct. Yes, you're correct. Now, what we have talked about so far is, again, it's the exocrine function, as in pancreas is involved in another process or another system function, which in this case is the digestive system. The other function is directly related to the endocrine system. So if you guys remember, what is the importance of endocrine system? What do we produce when we talk about endocrine system? One word. Anybody remember that? Hormones, you got it. So right, correct. So the two main hormones that your pancreas producing, which is all of you guys probably have heard of the first one, right? Because we have talked about it, is insulin, right? Insulin is produced by a specific category of the cells inside the pancreas called beta cells. And beta cells are basically going to be the one that if you have too much sugar in your system, like right after you ate, or you had like a huge sugary food or drink or whatever, that causes the sugar level in your body to go up, it helps that sugar to be absorbed into your cells and be taken into your cells. In another sense, if I say, what is the job of insulin? Is to lower your glucose in your bloodstream, which again makes sense because if somebody is diabetic, because of the kind of imbalance in the insulin, their glucose level is always high. Now, the second part of this, the second hormone that is produced by your pancreas is a hormone called glucagon. Glucagon does the exact opposite of your insulin. So let's say you haven't ate for 10 hours. So what happens to your glucose level over that 10 hours? It starts to drop down. Your body never wants your glucose to go below a certain number. That number is typically 75, but sometimes people say 90. So it depends on which textbook you study. But typically we say we don't want it to drop farther than 75. So when your glucose level starts to drop down, what your pancreas is going to produce is a hormone called glucagon. And what that glucagon is going to do is going to take up the sugar that's been stored inside your liver and release that sugar into your bloodstream. So when that sugar gets introduced into your bloodstream, then your glucose level still starts to go up and you basically recover from low sugar. So kind of look at this, guys. Your balance of the sugar and the process of digestion, effective digestion in your small intestine is depending on the pancreas. So basically, if your pancreas is not doing what it's supposed to because of either cancer or some sort of trauma, then there's a really good chance that that person might not be able to survive for a long period of time after. Is there any question about this? Any clarification on anything? So the relationship is in terms of your ability to produce insulin. The question is, how does it relate to diabetes? So if you are type 1 diabetes, and I don't actually have a slide on this one or not, because it's mostly physiology. No. So if you have, if your body, your autoimmune system, so you have a basically immune system that attacks your own body, it's called autoimmune disease. If they attack your beta cells, basically they lose the ability to produce insulin. And that leads to diabetes. Because again, you cannot bring that glucose into your system. If you have type 2 diabetes, which is extremely unfortunately common in our today's society, it has a lot to do with bad diet. So it's not that your beta cells will not be producing insulin, they'll still be producing insulin. However, your cells that are not supposed to be sensitive to insulin, they're just gonna say, I'm gonna ignore the insulin. So you need more and more insulin in your system for your cells to actually function. So those are your two main types. Your body either doesn't produce insulin or your cells are insensitive to insulin. And both of those scenarios lead to high sugar in your blood, which basically is identified as diabetes. Awesome. So here's the shape of your pancreas. So if you look at your pancreas, basically your stomach would be sitting right here. So pancreas is actually covered by your pancreas is covered by your stomach. So you literally, if you're doing a dissection of either cat, pig, or even human, you actually need to literally retract the stomach so you can see the pancreas. It does has three parts. It has a tail, which is basically sits on the left-hand side. So here's your basically left part of the body. This is the right side. The midsection is identified as the body. And then this kind of a head portion is literally called head of the pancreas. Some textbooks refer to a pancreas as a tadpole shape. I don't know if that helps you remember the shape, but basically that they say this is the head and this is the little tail of it. Now, notice right here at the center of your pancreas, you have this duct. This is called the pancreatic duct. And this is something you learned about in your lab last week. But basically, all of the digestive juices that you have in, thank you, digestive juices that you have in your pancreas that needs to go to the small intestine are transported using this pancreatic duct. And again, this is the first part of the small intestine called the duodenum. So if I ask you guys in an exam, what a structure or what tube transport digestive enzymes from the pancreas to the small intestine, your answer would be the pancreatic duct. And there is an accessory duct here too, but it's not as main as the large one that we see right here. Now, another accessory organ that we have talked about and was mentioned last time was liver and gallbladder. So let's talk about liver and then we'll kind of go into the gallbladder. So this picture that you see, first of all, I want to make sure everybody's clear on that. This is literally taking your liver and turning it around. So the view you see on the top picture is the back of your liver. The picture you see on the bottom is the front of the liver. So if you're dissecting somebody, your liver would look like this, but usually we depict it like this because all of the structures and things that help you understand the liver anatomy are actually visible on the posterior aspect of the liver. So main thing, we have two big lobes on your liver. The big one is on the right-hand side called the right lobe, and the smaller one on the left-hand side called left lobe. And there is a separation line you guys can see here more visibly as this white line, less visible right here, called the falciform ligament. Hopefully you guys, you may or may not recall, falciform ligament is a way to basically position the liver and make sure it is secure in its place. So it basically, the falciform ligament you see is the attachment underneath the diaphragm to make sure that the liver stays where it's supposed to be. So if my top hand is my diaphragm, this is the falciform ligament. So this is the point of attachment for the liver to the diaphragm. Now, if you turn back the liver on the right lobe of the liver, which is the big one, right? Always remember the big one is the right lobe. You have two smaller lobes. You have one on the top right here. This is called the caudate lobe. And the one that is right next to your gallbladder, which is this green sac, is called the quadrate lobe. So caudate lobe and quadrate lobe. So that gives you technically 4 lobes within your liver, with the two main ones being your right and your left lobes. The other thing that you can see here is the blood vessel called the hepatic vein. So hepatic veins are these smaller branches right here, one on this side, one on this side, one for the right lobe, one for the left lobe. And they merge into the largest blood vessel we have here, which is depicted in blue. Everybody should remember this one, inferior vena cava. Remember inferior vena cava, guys? Sounds familiar? Where does it end at? Where is the final destination for inferior vena cava? Now tell me that question. Right atrium, good job. Correct. So basically, this is the one that collects deoxygenated blood from your liver. These two little ones, the hepatic veins, collect the oxygenated blood, turn it into the inferior vena cava, and inferior vena cava basically return it back to the right atrium of the heart for oxygenation. Now, if I look at the microscopic anatomy of your liver, so that's what you see right here. you can see these hexagonal shapes. They're really beautifully, basically preserved, which is really cool. If you're looking at our samples, usually they don't turn out this beautiful. But basically, these structures are called lobules, which basically means little lobes. And their goal, again, is to increase the surface area of the liver so liver can do more functions. Now, really fantastic thing about your liver, and this is another picture, I just want to kind of talk about it and I'll come back to this picture. Your liver does about 500 functions in your body, which is, to me, blows my mind every time I think about it. So a lot of people, and again, the second thing is because of its large size, it's the largest gland we have in our body. Because of its large size, you actually have to have significant damage to your liver for you to actually see visible changes in your body and basically being unable to perform these 500 functions. That's why when somebody is an alcoholic, right, their liver doesn't immediately give up, right? It takes typically years for that change to happen and for the liver to see the signs of the cirrhosis. Same thing with hepatitis, right? Hepatitis is the infection of the liver. They don't happen overnight. It's not an acute disease. They're all identified as chronic disease because it takes such a long time for the liver to basically be infected or damaged significantly to cause major symptoms in the body. Now, in terms of digestive system, what are some of the functions of the liver? Sorry, guys. My little one's back. What are some of the functions of the liver? One of the ones that I'm going to mention is bile production. So bile production carries a process called emulsification of fat. And what is emulsification? I just want to make sure I don't have a picture for it. Let's think about fat and your digestive system. Does fat mix with water? Please answer that question. Okay, thank you. Okay, so fat and water do not mix, right? So if you add, let's say, a layer of oil on top of the water, what happens is all of the oil molecules go together, right? And then water stays typically underneath it, right? So you have the water layer and all of the oil come together and basically stick together. So that's exactly what happens in your digestive system, guys. So in your digestive system, when you eat something fatty, all of the fat molecules like to blob up together. They don't want to be separated. They don't want to go different part of the small intestine. So what's the problem with that? The problem with that is that it's going to make a very small surface area, which is just the outside surface. And that outside surface is going to be very difficult for the enzyme to access because it's really a small surface area. So the enzymes that are going to help you, sorry. Sorry, guys, give me 1 second. I'll be right back. I apologize. Sorry about that, guys. Okay, so fat is basically going to be in these chunks inside the digestive system, really small surface area. And basically that's going to be really difficult for the enzymes such as lipase to digest it. So what does bile do? Bile is going to take that chunk of fat and chop it to little pieces. So when you chop it to little pieces, you're increasing your surface area and you're allowing all of these enzymes to have easy access to the fat. So when we're looking at the word emulsifies fat, emulsify simply means you're chopping it to little pieces. And that's going to help better access to the fat by the enzyme and easier digestion. So keep that in mind. We're going to come back to it in terms of gallbladder as well. In terms of digestive system and metabolism, it does some of the following functions. Your liver stores vitamins. Please note that the vitamins that it's going to store are 4 vitamins that are considered fat soluble, not water soluble. And they are D, as in dog, A, K, and E. I call them DAKE for easy remembering. That's my name. So D, A, K, E, and are all 4 fat soluble vitamins that we have. And you have to be really careful again with taking these because if you take too much of it, they can actually store significantly in your liver and cause liver damage. So be careful with that as well. It also, your liver has the ability to process fat and amino acids. So when these molecules come in, they process them to what your body actually needs and requires. The big function of your liver, which probably all of you guys know, is detoxification of poisons and drugs. So things like alcohol is identified as poisons by the body, and then typical drugs. And I'm not talking about hardcore drugs, we're talking about regular drugs that you guys take as medication. So these are all identified as foreign things that can cause damage to your body, and they need to go to your liver to be detoxified. So I don't know if you guys have ever undergo something like this, but when you start to take medication and those medications are identified as heavy medication or hardcore medications, they actually, over a few months, your doctor would write you a liver enzyme test. And this is basically testing to see how your liver is processing those drugs. And if these tests come back as high or elevated, usually your doctor needs to change your medication because those elevations in numbers imply that your liver is being damaged. So as it's detoxifying those drugs and those medication is actually causing damage to your liver. And that's usually not a good thing. Is this making sense so far, guys? Is there any question about that? So you mentioned fatty liver. Fatty liver is basically, any liver that is losing its function. That could be as a result of drinking, like alcoholism, or as a result of taking heavy medications, or even as a result of hepatitis. All of these can lead to what we call fatty liver. No, that's not bile, because bile is released into, sorry, the question is, I don't know if you guys are reading the chat box, but the question is, when someone throws up and empties their stomach and that yellow substance that comes out, is usually hear people say it's bile. No, because bile gets released into your small intestine. And when you're throwing up, you don't throw up from your small intestine, you throw up from your stomach. So what it is basically the digestive juices that are found in the stomach, even if your stomach is empty. So that's just a misuse of the vocabulary here. The last thing that your liver does, you're welcome. The last thing that your liver does is making blood proteins. I don't know if you guys remember this, but we talked about blood, and we said there's 3 main proteins your blood makes. That was albumin, globulin, and fibrinogen. And basically, if you have liver damage, you're actually going to see those changes in your blood as well, which is amazing, because I don't think anybody has ever thought about, oh, let me see if I have liver damage. Let me check my blood proteins to see if I have liver damage, right? That connection doesn't immediately get established. But your inability to blood clot, so if you start to bleed, if you cannot stop that bleeding, it might be a symptoms of liver damage. So that's kind of cool to me. Any questions? Let's continue. Not really, because water has a lot to do with your urinary system and filtering your blood. What we're talking about here is removing of the toxin. So even if you drink water, you still have the same amount of toxin that needs to be processed. So diluting them does not make a difference in terms of what your liver needs to do. Hopefully that makes sense. Okay. Now going back to the previous picture I had, right here, we have the liver. So kind of reviewing some of the essential structures. So you have your right lobe of the liver, the caudate lobe, the quadrate lobe, the smaller one on the bottom, the left lobe of the liver, and the separation by the ligament called the falciform ligament. Tucked in underneath your liver, you also have this little green sac, which I'm going to talk about in just a minute, called gallbladder. And notice that there is multiple branches of ducts that are coming from the liver and the gallbladder. So if you look at these two right here in green, one right here, one right here, this one is called the right hepatic duct, and this one's called the left hepatic duct. We're looking at the green lines, guys, not the red or blue. So if you're looking at the word hepatic, anytime you hear that, like hepatitis, that implies liver. So kind of associate those words together. So these two, right and left hepatic duct, are basically collecting bile from your liver to eventually transport it into the digestive system. The next one that you see is coming from the gallbladder is this little tube right here called the cystic duct. So that's come from the gallbladder. And notice that all of these three are going to merge together and form this little one right here, which eventually find its way to the small intestine. And this one real here called the common hepatic duct. So you have left hepatic duct, right hepatic duct, and cystic duct, which all form one major duct called the common hepatic duct. So Ashley is asking so does the liver detox pills and drinks a real thing? Like, do they clear? No, they are total BS, and I apologize for the language. There is nothing that can detox the liver other than the liver itself doing its job. So to me, whatever it's marketed as detox pills and drinks are basically hoax. There is nothing that can do that. So don't waste your money on it. Don't even bother. Sorry to ruin the utopic picture, but no, don't waste your money on that. Yeah. Nope, don't buy them. Don't waste your money. Literally the best thing that you could do is just eat healthy and let your liver do its job. You cannot go, and by you, I don't mean you, but as a person, you cannot go and drink like 20 glasses of, I don't know, beer or shots or whatever, and then comes like, oh, I'm gonna buy one of these drinks and clean my liver. That's not how it works. The damage as a result of drink will be there, and you by buying those detox drinks, you're just adding to the work of your liver, and you don't want to do that. I know, it's sad. But again, liver is absolutely resilient. So even if you look at people who get liver transplant, I don't know if you are aware of it, it's not a full liver. You actually just get a part of a liver when you get a liver transplant. When you get a kidney transplant or a heart transplant, you get the whole organ. Like you can get a part of the kidney, right? But liver, you can actually just get a small piece of the liver and you can still do the job. Yeah, it's pretty cool actually. So liver and pancreas are both those two organs that you can get just a small piece of it and they still can manage the job versus the other organs, you need the full organ to be able to do that. Same thing with your lungs actually. You can get a partial lung transplant. So you don't need a full lung to be able to do the job. I know, that's a really good thing about liver. That's why I get really fascinated by what your liver does in your body. Okay, so let's go ahead and look at some of the blood vessels that we have in your liver. So one of the first thing I want you guys to understand is going back to that whole concept of detox. So we just talked about the fact that when you eat, Not everything that comes into your body is technically healthy and good for you, right? We continuously, not on purpose necessarily, sometimes sometimes for pleasure, sometimes on for medication purposes, we have to take things that are identified as toxins by your body, right? So you don't want those toxins to get directly absorbed from the digestive system into your bloodstream and then basically get access to the rest of the body, because those toxins basically can cause harm to the rest of your body. So the solution your body has come up with, which is absolutely fantastic, is when blood that is absorbed the nutrients from the digestive system comes in, before it gets circulated to the whole body, you are going to send that blood to the liver with the goal of cleaning the blood and detoxing the blood before it circulates to the rest of the body. So you have main blood vessels, pay attention to this, main blood vessels that are coming from the digestive system to your liver for the purpose of detoxifying your blood. Those blood vessels that we have are called hepatic, as in liver, portal vein. And there's main ones called left and right. Again, you're going to kind of branch that blood that's coming, send it to the right and left. So what type of blood is it again? It's carrying nutrients from the stomach and intestine for the purpose of detoxifying it. So before, again, I'm going to repeat this because a lot of people don't make the connection that there's an extra set of blood vessels inside your liver. The hepatic portal vein comes from the digestive system to your liver, and it's the only system that has it. The rest of the body does not have this, with the goal of detoxifying detoxifying your blood before it gets circulated to the body. So whenever that blood gets detoxified, it's clean, it's ready to go into the circulation, then it goes to your hepatic vein that I mentioned before. And no, it's not oxygenated, it's deoxygenated. So this blood is going to be deoxygenated, and it's going to be returning into the inferior vena cava, and then again go to the heart for the purpose of circulation. The blood vessel that is going to basically supply the liver with oxygenated blood, that good blood that your liver needs to survive, comes from what? Hepatic artery, which again brings blood to your liver, and that blood is going to be oxygenated. Does that make sense so far, guys? Any questions? So looking at your liver, let's just show you a picture so you guys can kind of visualize it as well. So the one, see, there's three types of blood vessels: the red one, the blue one that you can see up here, and then there's the one that looks purplish. So purplish basically implies that it's not fully oxygenated and fully deoxygenated. So it's somewhere in between. So these are your portal vein that are coming again from your stomach and from your intestine. Portal vein comes in the purple line, follow it. It branches to the right and left portal vein. It goes to the whole liver. Blood gets detoxified. And then when it's done, it gets picked up by your hepatic veins you see right here in blue and gets dumped into the inferior vena cava. What you see in red here that branches to the right and left hepatic arteries, that's the one that's bringing oxygenated blood to your liver as well as your gallbladder. Awesome. Okay. So we have talked about liver. We know that the main functions in terms of digestive system is association with detox, creation of the bile, storing vitamin, processing fat and amino acids, and many other things. What is the function of gallbladder then? This little green sac that is stuck underneath your liver. Gallbladder, only thing it does, it stores and concentrates bile. So in an exam, typically, I ask this question: what organ produces the bile? The answer would be liver, right? what organ stores and concentrates bile? Then your answer would be gallbladder. Gallbladder does not produce any type of anything. Gallbladder doesn't do anything other than storing it. So again, notice the little sac, that's your gallbladder. Here is your cystic duct. And then cystic duct connects to the bile duct and eventually empties into the duodenum. And again, what is the goal of that bile? The bile is to emulsify fat. Remember, guys, I don't know if any of you guys have had it or know somebody that have it. Have you had anybody that has their gallbladder removed? Do you guys, anybody knows anybody? Okay, so Teresa actually had it removed. Okay, so are you healthy, normal, everything's good, right? Okay, so everything should be normal, right? If you remove the gallbladder, it's one of the organs that shouldn't significantly, I'm going to use a keyword, should not significantly affect your functionality. A lot of times, the biggest change you're going to see is that you lower your ability to eat fatty food, which kind of makes sense, right? Because what is the gallbladder doing? It is storing the bile that helps with digestion of fat. So when you don't have that extra storage and you eat something that is super fatty, you're just simply relying on your liver to do its job. So gallbladder may have a difficult time. So if there's no gallbladder, liver is the only one responsible. Versus if you eat something super fatty and you have a gallbladder, that gallbladder is going to help you basically process the fat a lot easier. So it's basically, that's the main function. Not necessarily. Honestly, this is what I tell my students. Depends on the person. I have heard people like for instance, my grandma can eat fatty food or any type of green leafy vegetable. That just bothers her. It doesn't make her gassy. It doesn't give her diarrhea. It just makes her stomach uncomfortable. Like she feels like super heavy and she can't process it effectively. So it's the symptoms of a person who has their gallbladder removed is not going to be identical. So do keep that in mind. It's like if you do a surgery, it doesn't mean everybody's going to have the same type of pain. Everybody has a gallbladder unless you remove it. So we can't use that general symptoms as, oh, you will have diarrhea if you eat fatty food. So just think about that. Yeah, so thankfully you can actually take bile salt. That it does help the process, but it's not, again, it's not as effective as you actually having a gallbladder. But typically the reason you have you remove your gallbladder is because you have what we call gallstones, right? That's the most common reason for removing of the gallbladder. And the reason for it, again, not always, but in many cases, is because your body has too much cholesterol, and that causes too much of bile salt in your gallbladder. And these bile salts can lead to they basically can form crystals. And these crystals can plug the cystic duct. So here's your gallbladder. This duct, which is your cystic duct, can be blocked as a result of those crystals. And again, basically, anytime you eat fatty food and the gallbladder wants to release that bile into the cystic duct, it needs to pass basically through this blockage. And it causes significant pain on the right-hand side, right below your diaphragm. Interestingly, many people, sorry, that must have been painful. Yes, these are your gallstones, basically. I know. So most of the time nowadays, they actually do ultrasound to see the size of the gallstones. And in many times, they just basically defer the surgery until the last moment, because again, it is a surgery that many people don't need to do. Some people can change their diet and slowly make that gallstone kind of pass through the cystic duct by itself. But if you continue to eat unhealthy food, things that are high in cholesterol, or you have the genetic disposition to form gallstones, then you eventually need to have the surgery to remove the gallstones, so you won't have that pain, basically. Any questions about that? Any concerns? Any clarification on anything? Good? Okay. Well, type your questions if you have any. Okay, so this slide that I have is basically what I'm going to describe for you guys on a picture, because it makes it a little bit easier to follow on a picture. So again, remember when you're looking at the duodenum, which is the first part of your small intestine, you are having things coming from your liver, from your gallbladder, and from your pancreas. All of these need to come into your duodenum for the process of digestion. So what are the duct system that helps you this process? So the first one you have is coming from your liver, and they're the ones that I mentioned earlier, called the right and left hepatic ducts. So this is one, this is the other one. And notice how they are merging together to form a larger duct. So this one right here, called the common hepatic duct. Anytime you hear the word common, as we looked at them in terms of blood vessels, is basically when two things that are identical are merging together. So it's kind of, okay, you made something that's bigger, we're gonna use the same vocabulary and put the word common in front of it. So you also have another blood vessel, not a blood vessel, duct coming from your gallbladder, which I mentioned multiple times, called the cystic duct, which is this one. Now, cystic duct and the common hepatic duct, which is this one, are gonna merge together to form this large one right here that's forming and eventually find its way to the duodenum, called the bile duct. So again, makes sense because both of these are carrying bile, and basically they're gonna eventually end up in the small intestine. So bile duct also merges with the one that coming from the pancreas, as I mentioned earlier, called the pancreatic duct. You don't need to call it the main pancreatic duct, just calling it pancreatic duct is sufficient. So when they come into your small intestine, or more specifically your duodenum, the opening you see right here, okay, is called the hepatopancreatic ampulla. So this enlargement that you see right here, which is basically the opening to the small intestine, is called hepatopancreatic ampulla. And it does have those circular muscles I mentioned before, called the sphincter. So basically you bring these in, but the sphincter is closed. As soon as this sphincter opens up, both the bile and all of the pancreatic enzyme gets released into your duodenum. So again, one more time, I just want to make sure this duct system are familiar to you, both for your lab exam and for your lecture exam. So you start with right and left hepatic duct, which merge together to form your common hepatic duct. Common hepatic duct merges with the cystic duct to form your bile duct. You also have one coming from the pancreas called the pancreatic duct. All of these join into the duodenum, which is the first part of your small intestine, in an area called hepatopancreatic ampulla. Again, hepato as in liver, pancreatic as in pancreas. Any questions about this? The duct system. I hate cold tea. Okay, so the last part of your intestines is basically your large intestine. So again, you looked at it in terms of anatomy in our lab last time. So we're just kind of looking at the same anatomy in a little bit more detail, and then the function of the large intestine. So first of all, and the jobs of your large intestines include digested residues that have basically passed through the small intestine are going to reach your large intestine, and you're gonna absorb a lot of water from that. So you're still gonna reabsorb water in the large intestine, but no nutrients. Please, very, very careful. Or even if there is nutrients, it's gonna be super small amounts. The other thing you're gonna absorb is electrolytes. Anybody remember what electrolytes mean? Any idea? When you hear the word electrolyte, when you drink Gatorade, what are you actually drinking? You keep like electrolyte. Okay, positive charge, salt. Yeah, salt is a really good one. So potassium, sodium, calcium, chloride, things like that are what we identify as electrolytes. So a lot of that gets reabsorbed, gets absorbed by your large intestine. The other thing that you have is you have a collection of bacteria called bacteria flora that are found in your large intestine. They do help with breaking down some of the indigestible material for us. And sometimes they can get some nutrients out of those for us. I shouldn't say nutrients, vitamins for us that are necessary for us. So having that good bacteria in our digestive system is really important. And that's why you take probiotics when you have basically susceptible to constipation, because that bacteria can help significantly with how effective your body is removing unwanted material. The other thing that your large intestine does is mass peristaltic movement. If you recall from our last lecture, peristalsis was basically does movement that pushes the food through the large intestine, so through the digestive system, kind of like pushing on the toothpaste to remove the toothpaste. That's the type of motion that you have called peristalsis. And basically, these peristalsis movements in the large intestines are going to be huge compared to what you see in the small intestine, because you basically want to collect all the unwanted material, which are the fecal matter, and eventually remove them from the body. Lovely topic. So there are subdivision of the large intestine. You have the cecum, and appendix is not actually part of that, but I listed it here because it's connected to the cecum. You have the colon, which has its own breakdown. You have the rectum, which is where the fecal matter gets stored, and then anal canal and anus, which is basically the path for removal of the fecal matters. A couple of special features you will see in your large intestines is something called tinea coli. Tinea coli is this patch of a smooth muscle you see as this white line that you have on the large intestine. What it does, it actually creates this puckering on the large intestine. And what I mean by puckering is these little pouches. So these little pouches themselves are called hostra. So hostra are basically, with the combination of the tinea coli, are important in terms of moving the material through the large intestine. And that's all you guys need to know. There's nothing beyond that. So do know the vocabulary. Again, tinea coli is that like the white line or strip that goes through the colon, and hostra are the little puckering that are created. Appendix, I'm just going to show you where it is. So if this is the beginning of the large intestine called cecum, this little extension you see coming off on the right lower quadrant of your body, it's called the appendix. It is actually part of your lymphatic system or your immune system. A lot of people, again, we do remove the appendix if you have major problems or it is ruptured. They do remove it because it can cause sepsis and lead to death. However, nowadays, many doctors decide not to remove the appendix and try to control the infection with taking medication. If it was, I would say, like 10 years ago, a decade ago, it was actually, and it was very common to remove it. Yeah. Oh, you have a pain on the thing. Oh, your appendix is inflamed. We're going to remove it. That was the typical procedure. Nowadays, they don't do it as fast because they think that appendix may have long-term functions that may benefit the person if it's kept versus removed. So sorry, you lost it. No more immunity for you guys. I'm just kidding. So the pattern for your large intestine, it starts with the cecum. It goes up, becomes the ascending colon. It turns around, becomes basically that horizontal line you see right here called the transverse colon, comes down, called the descending colon, and basically forms this curvature to push it to your butt. Sorry, it's very scientific. To basically move the intestine to the back, to the rectum. So that curvature that you see, kind of a S shape, is called the sigmoid colon. And eventually the fecal matter gets stored in the rectum. And when the body is ready, they get pushed into the anal canal and removed from the body. Couple of points about this. The anal canal is about 3 centimeters, so it's a pretty small canal. It is still part of the large intestine, and the opening of the anal canal actually has 2 separate sphincters, an internal and external. You learn about this for the urinary system as well. The internal one is always the one that is a smooth muscle, so something that we don't control. It's the one that basically keep the poop or the fecal matter inside, so it secures them inside. The external anal sphincter is a skeletal muscle. So basically, when you decide to poop, that's the one that you basically use to relax and allow the fecal matter to be removed from the body. So do keep in mind that, like urinary system, the intestinal digestive system also has 2 sphincters, one that is under our control, the skeletal muscle, and one that is under the control of your nervous system called the smooth muscle, and the internal anal sphincter. Any questions? Any other questions? Because I'm gonna finish up this slide and then we're done with digestive system, I believe. So quick note on terms of digestive system, we have 2 types of disorders that can basically cause major disruption into the digestive process and eventually removal of the fecal matter. One is called the intestinal obstruction, which could be as a result of a mechanical obstruction, such as like tumors or foreign objects or something that you ate, or adhesion, where basically instead of the tube being wide open, they kind of close or clamp on itself and makes it difficult for the food or unwanted material to pass through. Non-mechanical obstructions are what basically halt the peristalsis, the movement of food through the digestive system. That could be as a result of trauma or as a result of the intestine being touched during surgery. So if you have ever undergone a surgery, one of the first things that the doctor asks you is what? Anybody? Bowel movement, correct. So they ask you basically, have you pooped? Exactly. So basically they're worried that because of the procedure, you actually have halted or slowed down the peristalsis significantly, which basically affects you. So as a precaution, almost always they give you laxatives as part of the medication they give you to help you with that process. So they get really super happy if you're nurses or you've been around nurses, they get super happy when you poop. So I know it sounds disturbing, but honestly, like actually even farting is for some doctors are super exciting, because that means that the digestive system is working, which is a really big thing. So what happens to the digestive system as basically as you age? So up to basically middle ages, you're fine. So if you're kind of under 40-ish, you're pretty good condition. You shouldn't have any major health issues related to the digestive system. Typically around middle ages is when you start to see gallstones and ulcers. Not always. Mine was like 18. So, but in old age, one of the major things that happens is the digestive organs, logically, like all the other organs, that starts to decline. So you start to release less pancreatic juices, you release less bile, the absorption of the nutrients becomes significantly less efficient. That also leads to dehydration, constipation, dehydration of the fecal matter, and that leads to constipation. So it may sound really weird, but I always tell my students, and don't laugh at this, if you need to poop, go poop. Because anytime you hold on to your poop, I say, oh, I can't hold it, I can't hold it. What happens is, as that fecal matter remains in the large intestine, more and more water was being absorbed from that, which means the poop is going to get harder and harder. And that basically makes you susceptible to constipation. So even if you can hold your poop, it's not a good idea to do so, because that basically makes you more susceptible to constipation and can cause polyps or hemorrhoids as you age. So take it seriously. I know it's kind of disturbing to talk about poop when you need to poop. I'm like watching all of these videos for my little one to potty train her, and like, go poop, go poop. And but anyway, so it's still true for adults too. Yeah, if you have bowel obstruction, it is painful. It doesn't matter, again, it's mechanical or non-mechanical, but if it is, it is very, sorry, it can be very painful. We actually had a person that did, what do you call it? Gastric bypass. But they didn't do gastric, but they did one of the surgeries. I don't remember which one was it. But unfortunately, what happened was they ended up having adhesion. So what I was talking about here. So after the surgery, the folds of the intestine the fold of the stomach start to be attached together. So she actually needed to go to the doctor every 2 weeks or so, and they would basically push air into her stomach to open up her stomach. But it was invasive enough that eventually she had bleeding and as a result died. So it was very unfortunate, but it is true that basically, even if it is a procedure that might be relatively safe, there might be a lot of side effects after the procedure. So I think, yeah, it was really sad. Basically, as Julia says, when nature calls, go. It's true for any sense, by the way. If that means throwing up, if that means pooping or peeing, yes, that is very, very true. Okay, so I'm gonna stop the recording. I know it's been only